coming talk. I would love to invite ANASTASIA FURTAK to the stage from the Ukrainian Catholic University Medical Clinic, and she's going to talk to us about caring for veterans and military projects of the medical clinic of the UCU. Welcome.
Good morning, everyone. It's a pleasure to be here with you today. I am ANASTASIA FURTAK. I am a general and pediatric surgeon in Medical Clinic of Ukrainian Catholic University and Sheptytsky Hospital in Lviv, Ukraine. And it's a pleasure to be able to present to you today how we care for veterans and military with the projects that we have in our clinic. So, I want to start with a little background that you all know. With the beginning of full-scale invasion, Ukraine faced challenges of reactive learning and restructuring of a healthcare system according to new arising needs. And national system, including healthcare systems, require data, require time and systemic analysis in order to adjust current programs and develop new programs according to the needs. And even with the best effort, it is not happening fast enough with the immediate needs that come, and also it requires excessive resources. So in the meantime, to fill the gap with the necessities of the war, there were over 20,000 of charities that stepped in, and by December of 2023, covered many needs in many fields. There was an increase of 74% of new charities that arose comparatively to prior to the war. Many new charities were developed, many existing charities changed their direction to cover war needs, and also many international charities opened their new chapters to help Ukraine. These initiatives together help cover ongoing demands and necessities, but also collect data and have systemic analysis of what is necessary and what works. And with this, I want to say that those charities are a big part of why Ukraine still stands. Medical Clinic of the Ukrainian Catholic University is a charity medical institution that was founded with the main vision and goal to heal the wounds of the war. It was opened in May of 2024, and since that time has been actively involved in many social projects, mainly focusing on veterans, their families, and military personnel. So these are some of the projects that Ukrainian Catholic University Medical Clinic was involved with or developed. Understanding the needs, but also understanding our own available resources and opportunities that we had. But the main projects of our clinic, and therefore the main focus of my talk, would be Veteran Plus program and damage control surgery course that we held. So what is Veteran Plus program? It's a healthcare and rehabilitation initiative offering free comprehensive care to Ukrainian veterans and their families. Why did we choose to focus on veterans and their families? So as of now, there is close to 1.5 million veterans in Ukraine, and the number of veterans tripled since the beginning of full-scale invasion. And we also expect that this number will grow exponentially. And according to Ministry of Veteran Affairs, by the end of the war, they predict that there are going to be 5 to 6 million of veterans. Also, taking into consideration that our military, our defenders, our active service members have enormously long deployment terms that last for years with only short breaks, as well as they develop somatic disease and early chronic disorders that are, but not limited to, hearing impairment, seizure syndrome, early diabetes and hypertension, early MI and strokes, COPD, musculoskeletal conditions. We also consider effects of acute and chronic long-term stress on mental and physical health, and therefore combination and complexity of their conditions, and therefore the need for comprehensive care and approach to these patients. As for the families, they carry disproportionate emotional and physical burden. They are the ones who take much responsibility to care for their military family member during the deployment and after the deployment. They also undergo constant stress of waiting their loved ones to return from the war and take responsibility of the family member that is serving that would otherwise take care of those responsibilities if he was or she were home. So realizing these challenges and needs, Medical Clinic of Ukrainian Catholic University has prioritized and made an effort to develop a program to provide available, free, holistic care to our veterans and their family members as a focus of its strategy of healing the wounds of the war. Who is included in the program? Obviously, veterans and their closest family members, partners, parents, and children, families of deceased heroes, families of missing persons in frontline service, veterans that returned from captivity and their families, as well as families of those who are still in captivity. And with special consideration, we also take care of our defenders and active service members. What is included in our program? So as I mentioned before, we practice comprehensive, coordinated approach. Services to our participants are free, and package per person is valid for 3 months and includes the services that are mentioned here: medical services, physical and occupational therapy, and rehabilitation, as well as mental health support. And the sessions are mentioned here. Those services can be provided gradually or simultaneously, depending on the need of specific patient. Some patients need only one service, whereas others need a combination of 2 or 3 services. We take each need of specific patient into consideration, and we also practice multidisciplinary approach with complicated cases to provide the best care we can. We also realize that working with veterans have there's specifics and need specific understanding. So we do have staff trainings, and our staff is required to complete some trainings to be able to work with veterans so that we can provide best care, but also safe care with effective communication. And we have more trainings planned for this year. After 3 months of the program, we conducted interim analysis of 182 patients that undergone our program, and the results are shown here. The first graph that you can see is the statistics of status of the participants, and as you can see, there is 68 patients that were either veterans, active service members, or our defenders. Out of age distribution, vast majority, over 85%, are within working age group that emphasizes the necessity of being provided with timely, holistic care in order to achieve the most possible restoration of work capacity, but also return to regular, healthy daily life. We are also planning to continue research as the program continues. We value the feedbacks of our participants as a proof if the program is effective. So I do want to share a story and a couple of feedbacks with you today. We had a 37-year-old veteran who walked through our door with a determination that this is going to be his last attempt. Prior to coming to our clinic, he was already diagnosed with severe depressive disorder with suicidal ideation as well as few attempts of suicide. He was hospitalized in mental facility before with no improvement, according to his words, by his discharge. By the time he came to us, he already developed a detailed plan of how to end his life. So he didn't really need another consultation. He needed someone who will show him care, and he needed to be seen and heard and be in a system that will provide care and result. Our family doctor met him with deep empathy, and she quickly mobilized a multidisciplinary team. Together, we focused not only on stabilizing his condition, but also on restoring his sense of dignity and hope. Through coordinated effort, we arranged for his urgent hospitalization at the State Institution Lisova Polyana Mental Health and Veteran Rehabilitation Center. He left our facility not cured, but with safety and hope, and a hope for healthy living. Another feedback that I want to share is from our veteran, who is 52 years old. He said, "This program is a big advantage. Personnel of the clinic is friendly, welcoming, and always smiling. They help me understand my condition better. This program is very beneficial, and I have shared and will continue sharing about it with my comrades." Another defender shared, "I underwent rehabilitation after surgery at UKU Medical Clinic. Everything is organized at high level. It is nice that they managed to assemble such an excellent team of highly qualified specialists in medical institution." And the last feedback I have is, "I sincerely thank the entire team of UKU Medical Clinic for their help and the high level of service. Indeed, there is something to compare it to. From the first visit to the end of examination, everything was at a high level, attentive staff, modern equipment, and sincere care. I'm especially pleased with the program they have for military personnel, Veteran Plus. The doctors are professional, explain everything in details, answer questions, and really want to help. The atmosphere in the clinic is calm, relaxed, and you can feel trust and respect." I'm sharing this not to brag that we have an awesome program, but to show that we worked hard to develop this program so that we can have a comprehensive, good approach, an effective approach to our patients, and the feedbacks we have just encourage us that it wasn't for vain. So on distribution chart, you can see that there was an increase in number of patients monthly as the word about the program spread. And with this, our future steps are, as you can see, we do want to develop partnerships. We realize our limitation as outpatient, young clinic, but we also realize the extent of the need. So we do want to be open to sustain and advance the program, and we want to develop partnerships to conduct data analysis, research, share experience, develop improvements to achieve sustainable long-term program, as well as we want to find collaboration with other organizations to expand and utilize the program. And we have plans for continuous staff training and continuous work with our partners. So now I'm going to move on to another program that we have that is my heart's love, damage control surgery. So in May of this year, we organized damage control surgery course with the help of Husoma, Ukraine, based at training center of Lviv National Medical University. And we had trauma team from level 1 trauma center in Macon, Georgia, who came to lead this course. What was the inspiration and thought behind the course? So in November of 2024, I had an opportunity to complete 2 days training on damage control surgery that was organized by Husoma Ukraine, that had been organizing those courses since 2020 and have trained about 400 surgeons, mainly focusing on surgeons in the front lines. And the course included a theoretical day and hands-on training on live biomaterial. Prior to the war, those kind of trainings were not available to general public of surgeons. So I found this training really relevant for multiple reasons. First of all, prior to the war, Ukraine has never encountered such devastating cases of trauma and such a complex trauma. We were not a trauma country. In our training programs during our residencies or internship, as we call it, we don't have separate trauma specialty. It undergoes general surgery training, and honestly, we don't have like a curriculum that will cover a good training in trauma cases. It just depends on where you are and where you have your residency. We also don't have specialists that are equal to trauma surgeons in the US. Usually our trauma cases undergo under general surgery care or traumatologist if it concerns musculoskeletal trauma. Other reasoning was out of data that I collected from our contacts, surgeons in the front lines who we stayed in touch with, and some of them have high positions and oversee multiple surgical units in the front lines. And I'm sharing this data with their permission. And it's a review of over 400 frontline surgeons. So about 75% of the surgeons in the front lines are civilian surgeons that were drafted or volunteered to go but never had prior military medical training. About 30% of the frontline surgeons are those who are less than 2 years into their independence practice experience in surgery. And about 25 to 30% are the surgeons who are not specialized in general surgery. They are specialized in OBGYN, they are specialized in neurosurgery, pediatric surgery, or subspecialized in minimally invasive surgery, as well as orthopedic and traumatologists, but didn't have much training in trauma or had no training and experience in trauma before. And lastly, as I mentioned before, the trauma cases that surgeons encounter in this war are extremely complex because of the weapons that are being used, and also complicated by a delay in evacuation oftentimes. So with this in mind, when we got an opportunity to invite US surgeons, this was the training that we thought is going to be the most relevant one. And there was a surgeon who was willing to come from Macon, Georgia, Level 1 Trauma Center, Dr. Benjamin Christie, who has very high qualification in trauma. He also mobilized for four more colleagues to join. And with Husoma's help and with Lviv National Medical University, we were able to conduct the course. Within 24 hours of opening the registration, we had full list of interested frontline surgeons who wanted to come, as well as waiting list, which showed that this course is relevant. We had 18 frontline surgeons who were trained. We had 40 auditors for open didactics. Didactics included extended sessions on damage control surgery and resuscitation, as well as austere environment trauma care by a US career combat surgeon, and a lecture on working in limited resource setting from a career missionary surgeon from West Africa who works in limited resources. We also had 2 days of hands-on course in Pig Lab, where we covered abdominal and thoracic damage control surgery, as well as other trauma procedures depending on group request. So meaning bowel injury, biliary injury, vascular injury, and urinary injury. After each training, we had the brief to figure out how we can make the course better. And upon their return to their positions, for weeks after the training, our participants had sent us videos and pictures of how they did effective arterial shunting, open emergency thoracotomy, after being able to get practice in our hands-on sessions. And we also stayed in touch with our participants for next courses and for more collaboration. And with this, our next and future plans, our next damage control surgery course that we plan to have in spring of 2026 with improved curriculum. And also we are exploring opportunity to collaborate with Macon Trauma Center to have US on-site trainings for Ukrainian frontline surgeons in trauma and acute care. And with this, I'm thanking you for attention, and we are open for collaboration to put our efforts together for good cause.